Good evening. It's the 30th of January 2025. My name is Neil Davison. I'm 54 years old from a small village in South Norfolk in the UK. For those who are joining me for the first time, thanks for watching. I was diagnosed in August 22 with prostate cancer. I had 5 out of the 16 biopsies which were positive, mainly 3+4s. In April 23, I had the prostatectomy, and unfortunately, throughout the summer of that year, the bloods kept creeping up, and we had a reoccurrence. 0.2 was reached in January 24, and last year we had radiation in April and May. Had 20 fractions of radiation. So at the minute we're just having 3 monthly blood tests, and the results are coming down. And the first result was from 0.20, I was 0.07, and then in October 0.04. So it's coming down well. I've got another test in about a month's time, and I'm hoping that it will go down to 0.01, so all is good. So this video is mainly questions and answers brought together. I have a lot of people who comment on my videos. I have a lot of people who stop me at work and ask me different questions, and different places ask me. So I'm going to just put together some sort of 10 questions and answers about my journey. So number one, a lot of Facebook groups, always people are asking the question, do you regret the decision to have the prostatectomy over radiation or brachytherapy? The simple answer is no. I have absolutely no regrets whatsoever. I think one of the reasons why I had the prostatectomy, I just wanted to get rid of it out of the body. I was 52 at the time, and I just didn't want it in there. And I knew after research that if you have the prostatectomy and it does come back like I did, you can always have a dose of radiation afterwards. So that was one of the main reasons. And I know people who have radiation first, then can't have the prostatectomy afterwards. There are some occasions where I think you can, but more often than not, they won't do the prostatectomy, the operation after radiation. So that sort of swung me in thinking of just get rid of it out of the body. So no, I had no regrets whatsoever. I was happy just to, before it starts spreading, to get rid of it. Now, when the pathology report came back, I had a positive margin, which meant it was touching the sides and trying to escape. Hence, what I know now, with the positive margin, the little flecks were touching the nerves, and hopefully the radiation has cleared that up afterwards. So did I have any regrets? No, I didn't. Far from it whatsoever. Question 2. How did I feel after radiation? Radiation was tough. Initially, the actual sessions itself wasn't too bad. I have done a video about the radiation session at the Norfolk and Norwich Hospital here in the UK. The radiation sessions were quite hard to prepare with the amount of water you need and the food, what you're eating. You just have to be really careful. I had 2.5 litres of water before I went to the hospital, and I tried to eat not as much so the bowel was clear as possible. How do I feel after radiation? The actual radiation itself was not a problem. It was the side effects afterwards. I think after about 4 weeks, I had 20 sessions, and after 4 or 5 weeks, it really did knock me for 6 when it comes to fatigue. And yeah, it didn't hurt. I had a little bit watery diarrhea, but it was the fatigue afterwards. It probably took me 2 or 3 weeks to sort of get back to myself. The body needed the rest. The body needed the rest to heal. So yeah, it was probably 3 or 4 weeks afterwards, and I sort of got back to myself, started doing a bit more exercise, start eating properly, and got back to myself. So the radiation itself is not too bad, it's just the side effects afterwards. Question 3. Did I get any help after the treatment and after the operation? Yes, in a way. The nurses who look after you, who are assigned to you, they do ring you up to make sure you're all okay and everything's going well. You have appointments with the surgeon at regular times. I think it was like every 3 months. You would have a PSA test done at the doctor's, and you will then go and see him to discuss the results. So then I could ask any question I wanted, and because I was quite knowledgeable about the subject, I asked loads of questions, and he was happy to answer. Mr. Illy, who's the lead consultant urologist at the Norfolk and Norwich, was more than happy to answer any questions that I had. So we got the help, we got the support from the NHS. The next question is, how do I feel nearly 2 years after the operation? Yeah, I absolutely feel fine. I say I've got no pains whatsoever. I'm back to full fitness. Probably just taking it a bit more steady rather than charging around like a bull. It just, I used to play bowls for England, but I've trimmed down on the bowl sessions. I was probably playing 2, 3, 4 times a week, but now I'm only playing once. I'm just taking it a bit more steady, just looking after myself really, rather than doing all, driving all the way around the country and to the different bowls matches here in Norfolk. So yeah, we're just taking a bit more steady really, but health-wise, no problem. Haven't had no time off work. The wound's healed well, and all seems fine. Next question. Would I have done anything different? No. I'm glad I did, investigate about the prostate. I've set up my little YouTube channel, which is doing well. I'm now on 1,870 subscribers, which I thank every person for subscribing to me. I wouldn't have done anything different. I've done a lot of research as I went along and investigated what was going through and what I was upcoming with the radiation and the prostatectomy. So I was all prepared for what was going ahead. So if I was to give a tip or a trick, I would just try and understand what is upcoming, what is the radiation. Again, for any person who wants to know about the radiation sessions, I've got a video on my channel to explain that and actually watch a session. So I wouldn't have done anything different. Again, I listened to people who had been through it. So yeah, that's another advice. Just listen to people who have been through it. There's colleagues at work who've had what I've got, and just listen to them and take note of what they do. Is there any tips to give anybody now going through the journey? Really, not so much tips. I just think just make sure you've got good support around you. Your family and your friends are really, really so helpful. You need them. You need to talk to somebody. The one thing going through the catheter, I've got a tips and tricks video. The one big thing is just make sure you drink plenty and just make sure you rest afterwards. Your body needs time to heal. Just take your time. There's no rush. You just need that little time. But I think the big thing is to have support. Have someone where you can talk to, whether it be somebody at work, whether it be your partner, your family, your friends. Just have someone to talk to, and just get it from the chest. Don't keep it within. I know a lot of things I read on Facebook saying, "Oh, my husband won't talk about it," but just get it from your chest. Just speak to your partner and your family. So I think that's the only big tip I have, is just to get it out. Next question is, where do I get my private tests from? I use a company called Graham Fulford, Charity Trust. They do send home test kits if you need a home test kit, but they do a lot of these road shows where they go to Lions clubs, rugby clubs, Mason clubs, and all you do is basically go onto the website which they have. You create yourself a little profile, and if there's one near you, you just click on the event. And again, as I say in my other videos, if you were to do a private test with Bupa, Spire here in the UK, they probably want £140, which is a lot of money for a blood test. The Graham Fulford Charity Trust do one for £25, £26, £27, which is very, 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 very affordable to most people. We've got one here in Norwich coming up in the next 4 or 5 weeks, which I will be attending to see what my latest PSA tests do. And the good thing about the Graham Fulford Trust is that they do the results in 2 decimal places, which was what I was looking for. So yeah, the Graham Fulford Charity Trust, or mypsa.org.uk. Very good, helped me a lot, and I've spoke to one of the trustees today, and we had a good chat about what's going forward. So that's where I get mine from. Was the radiation session a problem? No, it wasn't a problem. You just have to prepare your body. You have to make sure your bladder is as full as can be, and your bowel is as empty as can be. So every day, again, I had to drink a certain amount of water before I went up there. Once you're up to the radiation in the hospital, you will have to go to the toilet to empty the bladder, and you are then given a bottle of water. And mine was 450 mils, which you have to then drink and keep within the bladder. And ours was about an hour before you had your radiation session, so your bladder had to be as big as can be. So it's pushing the bladder away from your prostate bed, which was radiated. Again, just be careful what you eat. Don't go start eating beans and different things to give you the wind, because if you have trapped wind, the lower end of the bowel, again, they won't do the radiation session. I had 2 sessions which were cancelled because the bladder wasn't full once, and I had too much wind trapped in the bowel. So they just put it on to the end of the session. So I basically had 22 sessions rather than 20, but it's just management really. So apart from that, the radiation was no problem. Again, in my video I tell you that it certainly doesn't hurt. It's no problem. Next question, I've got 2 more questions. How long after the operation did you feel better? Again, you just have to take your time. I know the week I came home from hospital, I started to do a little bit of walking. I think the first day was only, say, a couple of 100 metres. But after sort of day 3 and day 4, I was walking around our village, a mile, 2 miles. And it's just that little bit of exercise you need. You may have a lot of carbon dioxide still in the body you need to get rid of. You need a bowel movement. But I took a month off work. Again, your wounds in your stomach needs 3 or 4 weeks to heal, and you're not allowed to lift anything. So I was okay after the operation. It's just a bit sore, and so you just have to look after the wounds. One of the wounds I had did need some sort of little bit of treatment. It didn't heal properly. Got an infection in there. So just backwards and forwards to the doctors to get some antibiotics to clear that up. So I reckon, I took a month off work, and after that you just go on light duties at work. It's all to do with not lifting a lot, and luckily I have mainly an 80% office job, so it was okay for me to take a time just to get back into work. So yeah, I'd say most people will take 4 to 5 weeks off work. And my last one, again, I'm just going to sum it up. 3 tips to give everybody about the whole journey. Again, number 1 tip, drink plenty of fluid while you have your catheter. We have a catheter mainly in the UK for 14 days. I know a lot of the Americans will have it for 7 days, but I learnt my lesson. I didn't drink enough water. I had to go back into hospital to have one reinserted, one taken out, reinserted, and believe me, it's not nice. So that's my one tip. The other tip is, again, to just talk to people, talk to as many people as you can about it. I have not had one person who's walked away from me. Everybody is interested. A lot of people, I go to sort of groups, meeting other people who are going through the same journey, and that also helps you just to get it off your chest. And the big thing is I want to say at the end is to anybody who is of my age, early 50s, to try and get tested, please. Really, really is really important. I had no symptoms. I say a lot of people who watch me know that I had no symptoms when I got tested. I went to Latvia in 2022 in August and had a random blood test for no reason. It's just because a blood test consisting of 11 different things cost me £17, which was €20. And from that, it was detected I had a PSA of 5.6, which is just above the 3 to 4 mark. And from that, I had five tumours. So really do encourage, especially those here in the UK, for a very, very affordable price of £25, go onto the Graham Fulford Charity Trust, type in your postcode, and they will show you an event which is close to you. You just log on, log in, pay your £25, turn up, blood test, job done. It goes on your portal, and without using this Graham Fulford charity, I presented the results to my hospital to show that my results were going up, which they then, I think, maybe gave me the radiation a lot earlier than normal, which was probably about 2 years, because I normally had to get to 0.40. Without the Graham Fulford tests, I'd have never been able to do that. So the Graham Fulford is just a UK-based charity. So please, 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 any person of my age who's interested in a private test, check the website out. Ring them up. They're really, really nice people and will explain everything. So I know a lot of people who do use this Graham Fulford. There's a lot of people who live near me, go to their events, and are very grateful that I've found a cheap alternative to Bupa or Spire. So that's just a quick sort of 15-20 minute video of where we are for some questions and answers, as I get asked a lot of questions throughout the year. So I'm just trying to bring it all together, and it's still part of my journey. We're still having tests done, but we're getting there, and we feel good. And hopefully the one in early March will give me the 0.01 I'm looking for. So many thanks to every person who views my videos. And I say the 1,870, I believe, subscribers now. I want to thank every person who have subscribed to me. So I say the money I raise go to a place in Durham called Durham Cancer Care, which are more than grateful of anything which we give them. So many thanks. We're going to end the video here, and we'll do another video in a few weeks' time to give you that result of the next test, which is going to be probably 9 months after the radiation. So many thanks, and we'll see you then.